And welcome to the Dr. Bob Show. People in the United States may not be taking as good care of their eyes as they should be. 12 million people in the United States, 12 million have impaired vision. 1 million people are blind. Other people have problems with their visual acuity. As people are getting older, more and more people are having problems with their eyes. And the problem is 50% of people projected in the future have not even seen the eye specialist. It's so important, and we're going to be spending this show talking about problems that can cause blindness, that can be prevented, and all we have to do is take the advice of our eye specialist. Our eye specialist on the show this evening is Dr. Darin Smith. Dr. Smith is a board-certified ophthalmologist, MD eye doctor, and he'll be guiding us through what we can do to protect our vision, protect our eyesight, so that blindness won't be part of our life later on. I can't wait to get his answers. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. And we'll be seeing how good health in general also can help your eyes. A lot of information on this show. You'll want to stay tuned. We're talking with Dr. Darin Smith, board-certified ophthalmologist, eye physician, and we're talking about impaired vision, about things that might lead into blindness, and what we can do to prevent that. Darin Smith, it's always a pleasure and an honor to have you on the show.
Well, thank you. Thank you for having me again.
I appreciate you taking the time. You know, I was thinking of my eyesight. The day after I was 40, I had to get a little longer arms, and then I got contact lens. One eye was a reading glass, and then that did absolutely perfect. But as time went on, there were other eye problems that needed care. How do we decide how often you need to see an eye doctor?
I mean, so it's a great question, and a lot of this is about prevention, right? So, I mean, I think the need to see someone starts pretty early. I mean, even as young children, you know, there's a lot of things that kids can have as far as lazy eye and that sort of thing that if caught early, you know, and treated, kids can do well. So I think certainly, you know, once every 5 or 10 years when you're younger, you know, as you start getting up into your 30s and 40s, maybe, you know, every few years, something like that.
How about once a year?
So I think once you're kind of 50s and up, you know, every year or two, I think it's pretty much a very standard recommendation.
Yeah, because we've got so many things that can start occurring that can impair your vision. And you've only got 2 eyes the last time I looked. And so it's very important that we take care of those. So let's talk about nearsightedness, farsightedness. Well, what's happening to the eye at that time?
So really, you mentioned nearsightedness, farsightedness, and there's a third thing called presbyopia. But the actual terms, people will use these terms nearsighted, farsighted, and kind of get tripped up a little bit. So really, the medical terms would be myopia. Basically, people who are myopic, what that means is they need a minus-powered lens in front of their eye to see in the distance. So generally speaking, people who are nearsighted or myopic see a little bit better up close than they do in the distance.
And that really impairs somebody. They can't see who's in the back of the building, or they can't see who's on the side or when they're driving. So
no doubt.
That causes problems. How about
So far-sighted people are what are called hyperopic. That just means they need a plus-powered lens in order to see in the distance. Now, a lot of people who are hyperopic have a hard time seeing distance and up close. So being myopic, a little myopic, or nearsighted is a little bit easier for some folks than being farsighted or hyperopic.
So when somebody realizes things are blurry, and they can't really see things, and they come to your office, is it because where the light is going back in the back of the eye, the retina, where they're really seeing, and you just adjust the way the light comes in?
That's exactly right. That's exactly what lenses are doing. They're changing the focus of that light so it's being focused directly on the retina.
Is it pretty exacting?
Oh, it would be fantastic. I mean, anyone who's had a pair of glasses on before, before they ever had glasses, when things were blurry, sometimes you put a pair of glasses on for the first time and you think, oh my goodness, trees have leaves, not just a green blob, for example.
And that must be so exciting to people. I always think of, that's more common in third world countries and foreign countries, but it's common in the United States.
Oh, extremely. Extremely common.
Yeah. So how often, if you have problems and they're corrected by a lens, how often does that have to be corrected?
So as far as like updated prescriptions, usually every year or two, although sometimes prescriptions can stay very, very stable. It's just a matter of, seeing someone on a regular basis. And then if you're having problems, make sure you get seen again.
I loved my monocular lens replacement. What else is available other than glasses? What can you do for somebody that's got nearsightedness, farsighted?
Yeah.
Anything else you can do?
So yeah, sure. So the most people end up with glasses. I mean, that's just your kind of standard stuff. And if people don't want to wear glasses, or sometimes people just see better out of contact lenses, which are little lenses that go directly on the eye. Very common, people, I'm sure there's millions and millions and millions of people wear contact lenses. The one thing we didn't really mention yet is that the presbyopia. That's just as we get older, our lens inside the eye starts to lose its ability to find focus for up close. So that's when people end up in reading glasses or bifocals. You asked about different ways to treat all this stuff. Well, LASIK surgery has been around for many years. Back in the 80s it was RK. For the last 20 plus years it's been LASIK.
Now, what does LASIK surgery do? What part of the eye? Because we've been talking about the retina and the back part of the eye. Now we're talking about the front part of the eye. Is that right?
Yes, right. So the cornea is the clear dome of the eye, is what goes when it first hits the eye. So the cornea is if you're a contact lens wearer, you put the contact lens on the cornea. So what we're doing with LASIK surgery is we reshape that cornea so that it's focusing the lens, or focusing the light directly on the retina.
Everybody I know that has LASIK surgery says, I love it. Is there certain restrictions, certain ages, certain people that are more of a better candidate for LASIK surgery?
Sure there is. People who are really farsighted, or what's called the hyperopia, LASIK doesn't do quite as well on that as they do on people who are myopic or nearsighted. The other thing what LASIK does not do is it does not fix that presbyopia. So if you're over 40 and you get LASIK done, you're going to be in reading glasses. That's basically guaranteed for most people. So it's not that you can't have something done, it's just understanding what the limitations are and what you're willing to live with.
When you see a patient, you dilate up their eyes so you can see in the back of the eyes. What does age-related macular degeneration look like? That's big, long words. What does that mean?
Yeah, so first off, even before I get to that, I just want to make a plea for people to actually get dilated. Okay, so we can see a lot of things when we dilate the pupil and actually look back there. That's where we can see a lot of pathology. So if you're just getting your eyes checked at like an optical shop where they're not really doing an examination, potentially they're missing things. So even though they could get you a pair of glasses, you really want to get, when I talk to you about the getting seen and being screened, you really want to get that dilated pupil exam.
So what can you see if you dilate the pupil? And we were talking earlier about this, other medical problems. What are some medical problems you can see better, or maybe the only way you can see it when you dilate up the pupil? What illnesses can you see?
Most common one would be diabetes.
Diabetes?
Diabetes in the back of the eyes. We can sometimes see high blood pressure. We can see signs of high cholesterol and plaques in the carotid artery or even in the heart.
So you were telling me somebody said, my husband has this, and said he needs to get the emergency room. Ended up having aortic surgery just because of discussing his eye problems.
Yes.
So you can see, and we'll talk about some of those later on, but it's so important, and sometimes the eye doctor sees the illness before anybody else.
Yes.
Which I think is amazing, wonderful. To me, that means see the eye doctor and get dilated and take care of those eyes. It's so, so important. We're going to talk about macular degeneration when we come back. We're talking with Dr. Darin Smith, board-certified ophthalmologist, MD, eye doctor, and we've been talking about the need for glasses, nearsightedness, farsightedness, presbyopia, the problems that go on sometimes naturally, sometimes faster than others, and how they can be corrected with glasses or maybe even LASIK surgery. The surgery is on the front of the eye, the cornea, and guiding the light is guiding it to the back of the eye, the retina. Now we're going to talk about another part of the eye where we call age-related, I don't like that, macular degeneration. Where's the macula and where is the vision on the macula?
Okay, great idea, great question. So the retina, like we already mentioned, that's the inside lining of the back of the eye. That's what light gets focused onto. The macula is like the bullseye for the retina. About 90% of our vision actually takes place in the macula.
So that's a certain part. What happens with macular degeneration? And there's a wet and a dry. Which one is common and what can you do for which one?
Yes. So with macular degeneration, and the reason it's age-related, it's almost like the retina just starts to wear out. Okay? And so there's two forms, like you mentioned, there's dry and there's wet. Wet refers to there being blood or fluid underneath the retina. Right now, there's really no good treatments for the dry. But generally speaking, the dry form is not nearly as bad as the wet for most people. That's not always true, but for most people, the dry isn't nearly as bad.
But I think the problem is if the dry eventually goes on, why does the dry go to wet? What happens?
So, well, what happens is it starts to get new little blood vessels that grow underneath the retina. And so for the dry part, the only recommendation that we have right now are to use some vitamins. And so there's a lot of different vitamins that are made for dry macular degeneration. The wet form, back 20 years ago, was basically a death sentence for the vision.
Yeah.
There was very little you could do. There were laser treatments, but none of those laser treatments usually resulted in good vision. So nowadays, there's injections. So a lot of your viewers might know of people or hear of people getting injections in their eye. Most of those injections are for macular degeneration. There's a few other things that injections are good for as well, but macular degeneration would probably be by far the most common thing.
I've talked with people that have had injections into the eye, and I said, wow, doesn't that hurt? And they said, no, the way the treatment goes, you inject medicine into the eye that makes those blood vessels not form again behind the retina. That must be amazing to see also.
Yes, well, and it sounds awful, right? Getting a needle in your eye, but for most folks, do just fine with it. And what it comes down to, it actually, for most people, it's a very easy decision. If your option is go blind or get injections in your eye, guess what you choose? You choose the injections, and it's really not that bad.
So is the eye sensitive on the outside of the eye that's injected? Do you have to put numbing medicine there before you stick the needle in?
They put a little bit of numbing medicine in there, but it's a very small needle. And again, it sounds terrible and it would sound something very scary, but it's really truly the difference between, for a lot of people, keeping the vision or not.
So terribly important. Let's go to another form of eye problem that causes blindness, cataracts. Tell me about cataracts.
So what a cataract is, it's just where the natural lens in the eye gets cloudy. And that's, for the most part, is just a normal change of life. I mean, as we get older, the lens gets more dense and it gets more cloudy.
What's a normal lens look like, before it gets older and cloudier? Is it just like clear plastic looking through
It's very clear. But as we get older, and there's other things, diabetes and smoking and family history sometimes of cataracts, and sometimes even babies get cataracts. So cataracts can happen for different reasons. But for the most age-related type of stuff, it's just life. It's just what happens in life.
So how does the patient determine that they may be getting cataracts, early cataracts? What's the problem?
So
what do they see?
Blurry vision, hazy vision.
So it just is, things are not clear.
Just lack of clarity.
How about nighttime?
Yes, that's what I said. Nighttime driving, glare, halos, that's a very, very common symptom. Sometimes difficulty reading, the little ticker tape up at the bottom of the television for news or sports. There's sewing, reading, there's so many different symptoms, and really it's just a matter of being seen and letting someone take a look.
So when you look, I've heard several people have said, well, you've got cataracts, but your seeing's okay, we don't need to take care of that now, versus, wow, I don't know how you see. How do you determine if somebody needs a cataract corrected?
So a lot of that, but not all of it, a lot of it has to do with what kind of problems is someone having. If someone is seeing relatively okay, even if they're cataract, you look in there and go, boy, that cataract looks like it'd be causing some trouble. But if they're happy with their life, seeing everything, maintaining a vision that they would be able to pass a driver's test, you don't necessarily have to do surgery. But sometimes you look at a cataract that you don't think that might be causing a whole lot of trouble, but someone is extremely bothered by it. And in that case, you do surgery and they're very happy.
So how do you do the surgery? You've got a lens in the eye. What do you do with it? You just, what do you do?
So surgery, cataract surgery, again, you think, gosh, how can someone do surgery on my eye? It sounds awful, but it's really not that bad. It takes, most of the time about 10 minutes, and we make a very small little incision.
How small?
What I make is 2.4 millimeters.
So are you looking through a microscope when you make those incisions?
Yeah, so the patient's laying down, and I'm looking through a surgical microscope, kind of doing surgery underneath the microscope.
And so you make a little incision in the eye, then what do you do with the old lens that's gotten dried up and old? Yeah,
so the old lens, we use what's called ultrasound. And so that ultrasound breaks that cataract up into small little bits, and we use a little vacuum, a little suction, and we suck that thing right out.
So what do you put back in?
So we put, everybody gets a lens implant. So lenses are usually made of some sort of plastic, and the optic of most lenses are about 6 millimeters. So in order to get a 6 millimeter lens through a 2.4 millimeter incision, what we do is we fold that lens up into a little cartridge, we slip it through that incision, and then open it up inside the eye.
Are there different types of lenses that you can put in the eye to sort of have a boutique lens replacement in the eye?
Yes, sir. So there's 3 different kinds of lenses. Now all lenses come in different powers, so we do some measurements so we know what lens power. The standard lens is what's kind of usually covered by insurance. Nothing wrong with the standard lens, that's what I do most of the time. For most folks, it works very well for distance vision, but doesn't give anything for up close.
So what are some of the fancier kind then?
So there's a type for someone with astigmatism. So a standard lens won't fix astigmatism, which is something else we didn't talk about when we were talking about the nearsightedness, farsightedness. Astigmatism is just an abnormality, abnormal shape of the cornea. And so there's a lens implant that can actually offset that. That's called a toric lens implant. And then there are different sorts of multifocal lenses, which can give distance and up close and treat astigmatism and the whole bit.
So you've got a lot of design before you put in the implant to select the proper implant to make it where the patient can see the best possible.
Correct.
What's it like when somebody comes out of the surgery and they're looking now, what do they see that's different?
So immediately after surgery, sometimes it's blurry. I mean, most of the time it's blurry. Now, if someone was really bad off, they can tell immediately. But a lot of times it might take a day or two.
What's the difference?
Brighter, colors are more vivid, things are clear. Where before everything just looked like there was a haze or a dullness. But the interesting thing is, because cataracts develop slowly over years, most folks haven't even put two and two together that things were dimmer or that the colors were dull until they get one done and they think, oh my gosh, what have I been missing?
This is a beautiful bird I'm seeing up in the tree and things. And that's what I've heard people say. The grass is greener and the sky is bluer, and it's really a great transformation. You mentioned earlier that if we dilated the eye, we could see lots of things, such as diabetes. Can you tell some problems with the eye if somebody has diabetes?
Yes. So
and that's what we're going to be talking about when we come back. You can actually see diabetes in the eyes. Well, that's due to blood sugar getting too high. What could you see in the eye? Can you see too much? No, it's something else that is a key for the ophthalmologist to guide the patient toward better health. We're talking with Dr. Darin Smith, board certified ophthalmologist, eye doctor, and we've had the best time talking about diseases that can cause blindness, but it can be corrected or prevented. So be sure and see your eye doctor. You may be finding out that there's a new world out there as they take care of your needs. I want to get to diabetes and what the eye doctor sees with diabetes. What's diabetic retinopathy? What does retinopathy mean?
Retinopathy just means disease of the retina. And so diabetes is one of the leading causes of preventable blindness. We're talking about prevention. And so what happens with diabetic retinopathy, little blood vessels start to get leaky. And so,
can you see a leaking blood vessel in the eye?
We sure can. We'll see a little protein build up, or sometimes little leaky splotches of blood.
So when you see it, do you say, uh-oh? Do you think of other causes of little splotches of blood? Or does trauma ever do that if somebody hits the eye?
Yeah, I mean, trauma can, high blood pressure can cause a similar type of look. But, a lot of times if someone's coming in for a diabetic, routine diabetic exam, which, by the way, every diabetic needs to have an exam, an eye exam, dilated eye exam every year. So that's going to be very important.
Every year, for sure.
For sure, if there's no problems at all, and then more often if there is a little bit of problem.
One of the things, some people get elevated blood sugar, they get what they call type 2 diabetes. That's just as bad on the eyes as type 1. So if your doctor says diabetes, time to wake up, see your eye doctor, get dilated at least once a year.
Yes, sir.
And again, you see a little leakage of blood vessels. Plaque, what's a plaque mean?
So it's just a little, for like if a plaque, it can be two things. So if there's a little plaque in a blood vessel, that would be a sign of a cholesterol.
You can actually see that.
We can actually see cholesterol. Now, the problem with those is that cholesterol did not originate there. It originated somewhere else, carotid artery, heart, somewhere else. So if we see that, that needs to be looked into pretty quickly, because someone could be at risk for a major stroke.
Yeah, and so you say, have you seen your regular doctor about the possibility of hardening of the arteries being in other parts? So can you treat diabetic retinopathy?
Yes, sir, you can. So I mentioned the swelling. Sometimes if the diabetes gets very bad, new little blood vessels will start to grow. That's called proliferative diabetic retinopathy. It's more dangerous. We talked about the injections. So the diabetes is probably the second most common reason people get injections in their eyes. That's for the diabetic swelling, and sometimes even for that proliferative disease nowadays.
There's a lot you can do once somebody gets diabetes, they're on a road toward blindness, and there's things that you could do to stop that pathway.
Yes, and it's like anything. The sooner you catch it, the better people do. But we might make sure patients never forget the very most important thing they can do is keep their blood sugars under good control. That's going to be by far more important than anything else.
Yeah, it's well shown in the literature. You get your blood sugar under control and your chances of staying away from blindness leading cause of blindness, diabetes in the eyes. So get your diabetes under control. We haven't had time to talk on glaucoma, a lot of pressure under the eye, about condition uveitis. There's so many things that are going on in the eye, and you do such a great job of explaining those. Thank you for coming to the Dr. Bob Show, and I hope that you'll come back again and teach us more about diseases of the eye.
Anytime. Thank you very much.
And remember, those things that we talk about every time we do the Dr. Bob Show. Be sure you're exercising. The exercising will help control your blood sugar if you've got early diabetes and will stop the progression. So exercise is good for eye disease. Eating the right kind of foods, certain vitamins are good. They'll help you. Getting your 7.5 hours sleep will make you more efficient. You'll be able to see better, and you'll be able to enjoy the world better. And most of all, what is it that we like? That laughter in your life. The more we laugh, the better our immune system works, the less colds we have, the healthier we stay. The people around you, the socialization will be better and easy. So get a lot of laughter in your life and you'll stay healthier.